I'm Bill Blackburn, Mayor of Kerrville, and we come to you once again to talk about what is happening with COVID in this community. I've got to tell you, there is a scary severity of COVID. We are seeing the numbers go up in the schools, in hospitals, in the hospital, places of business, even some that are having to close. The community leadership group met this morning to look at the stats, to look at the increase in numbers. And it was really a sobering time. Please remember the basic safety measures: social distancing, wearing masks, hand washing frequently, and getting the vaccine. I will tell you that this Delta virus, and you'll hear more about that, is so contagious. One of the things we're seeing is the number of families that are being infected. We have one family member who has it, maybe is asymptomatic, and then it gets spread to other members of the family. And the same is true in workplace and other settings. So today we're going to hear from our fire chief that continues to work on this, look at the numbers, look at what we can do, the possibility of vaccinations and places to get those, and also Cory Edmondson, the CEO of Peterson Hospital. And so at this time, first Eric Maloney, and then Cory Edmondson from Peterson Health.
Thank you, Mr. Mayor. I'd like to provide a little update, as I have in the past, regarding the community in Kirk County, what we're seeing in the numbers. So 1 second, I'll show the slide. Next slide. So a couple of numbers that we're continuing to monitor out there is the active cases, the number of deaths, and the hospitalizations. So the active cases currently of what DSHS is reporting is 173. And I'll talk about that number in a second, about the possibility that this is going to increase significantly. We also are seeing 102 deaths. And then currently with the hospitalization is at 39. We peaked at 40 on August 31st. This is higher than we've ever seen in Kerrville, even back in January when we had about 500 active cases that we were reporting. We have maintained the 30s at the hospital since August 19th. So we were in 20s for the longest time, and then now we've been in the 30s and even as high as 40 a few times, and Cory Edmondson will talk more in regards to that. Next slide. So the active cases that we currently trend is the blue line. And you'll see back on June 28th, and we've been monitoring this the entire time, we were down to 23 active cases that we had in Kirk County. That has steadily rose up to now, we were up at 200, now at 173. However, so after last weekend, we anticipate another significant increase in the active cases that will change in the next few days, and we'll continue to report that information out. And you can see the trend currently with the hospitalizations down below that shows that back in June 28th, we were down to 4, and that has been also a steady climb. Remember, with the community, what we continue to monitor is the hospitalizations impact our healthcare system. That impacts every one of us in Kirk County, not just that has COVID, but that needs to be seen and treated for any medical conditions that we have. So that is an important number to monitor, and Cory Edmondson will provide some more information on that. Next slide. So the vaccine in Kirk County. So we are still significantly under the state average for what we have, although we have seen an increase since the last time we reported out. So more people are reading about the vaccine, getting educated about the vaccine, and some now with the FDA approval of Pfizer are more comfortable with receiving it. So that number has climbed. So currently for Kirk County, we're at 45% of eligible residents are fully vaccinated. But as you can see for the state, so we're still 12% below the state average. For those 65 and plus fully vaccinated, we're at 62%. Compared to 77% of Texas residents. So we still have some work to do as a community in Kirk County to continue to get us in a place where we need to be in regards to the vaccine and specifically in regards to the hospitalizations. And you can see the vaccinations by age between 12 and 15 years old. Currently, 330 of those are fully vaccinated out of 2,300 eligible. And you see the individuals 16 to 65, a little over 11,000 are vaccinated for the 29,000 eligible. And then the 65 plus, a little over 9,000 are vaccinated out of the 14,000 that are eligible. Next slide. So the question is, so where can I get the vaccine? Where can I get the vaccine and where can I get tested? This is some information that has been requested so that we get questions on, that I know council have received questions on. I know the hospital is also. So we're trying to get some information out and keep this as current as possible to provide you information that when you provide the education, do the research, and want to get the vaccine, you know where to go. So HEB, both stores, they have the vaccines. They have Pfizer, Moderna, and the Johnson & Johnson. So they are available from walk-ins are welcome, Monday through Friday, 12 to 5, and then Saturday and Sunday only by appointment, so you can call ahead. Testing, the testing that they have available, they have the at-home test. There are two of them. They're called QuickView and Binax Now. Both are going quickly off the shelf, but as I do get them in, they are available at both HEBs. Walgreens, so the vaccine that they have now is the Pfizer only. That is Monday through Friday, 9 a.m. to 9 p.m., Saturday, 9 a.m. to 6 p.m., and Sunday, 10 a.m. to 6 p.m. So testing, they do provide testing there. You have to schedule with the pharmacy, and they do not allow walk-ins for the testing. However, you can walk in for the vaccine. Next slide. Walmart. So Walmart currently has the Pfizer for the initial dose, and then they have the Moderna available for those needing the second dose and for the third dose as it does become available in the fall. Currently, they're available Monday through Friday, 9 a.m. to 9 p.m., Saturday, 9 a.m. to 7, and Sunday, 10 a.m. to 6 p.m. They also have at-home testing, only the Binax Now. They also said that they go quickly off the shelf when they do get them in. CVS only has the Moderna vaccine. So Monday through Friday, 11 a.m. to 4 p.m., then Saturday and Sunday, 11 to 4. Testing, you have to schedule with a pharmacy, no walk-ins on the testing. And we'll provide all this information afterwards. The one I do want to mention also for the vaccine, next slide, is Peterson Urgent Care. So currently they have the Johnson & Johnson vaccine. If we remember, that is the one dose. You have to call to schedule that, and that is at 258-7373. Choose option number 2. They are available a short window of hours, Tuesday and Thursday, 7:30 to 8:30, and then 4:30 to 5:30. Have to have an appointment for that. Saturday, 8 a.m. to 9 a.m. for the vaccine. They are providing testing for asymptomatic if you have no symptoms, or if you have symptoms, Monday through Friday, 7 a.m. to 7 p.m., then Saturday and Sunday, 8 a.m. to 4 p.m. The Franklin Clinic also does not have the vaccine. They do provide testing. Only you have to schedule online at franklinclinickerrville.com, Monday through Friday, 11 a.m. to 4 p.m. And then, as always, the Kerrville VA does provide that for veterans, family, or veterans, spouse, caregivers, or widows. So you can get that out at the Kerrville VA. Next slide. So where are we at? So COVID-19 has not changed. So we had a break over the summer, but it is continued to be a public health threat that we're seeing definite increase in spread of the COVID-19, whether it be the original variant or the Delta variant, but the vaccine works. So Pfizer is FDA approved for 16 plus. This prevents serious illness and highly effective in preventing hospitalizations. The CDC reported that you are 17 times more likely to be hospitalized due to COVID-19 if you don't have the vaccine. So please reconsider the vaccine, especially the Pfizer. More information is available at the Department of State Health Services. They have links to the CDC and the FDA, great information to read through, or you can always ask your physician. Next slide. And with that, I'd like to turn it back over to Mayor Blackburn, and thank you for that.
All right, and now Cory Edmondson, CEO of Peterson Health.
Thank you, Mayor and Chief. I was encouraged by the increase in total vaccinations in our county. We've been kind of hovering at 40% forever, it seems like, and for you to report that we're at 45, that's encouraging to me as a hospital administrator, because that means less people would be admitted to the hospital. But first, good afternoon, Cory Edmondson, President CEO here at Peterson, and I want to give a shout out to our team at Peterson. Our doctors, nurses, support team, and staff, and our leadership have been dealing with this pandemic for 18 months. Not only have they been dealing with it at the same personal level as stress that the rest of the community is dealing with, but they come to work and they are faced with a pandemic that sits squarely on our shoulders. The team is emotionally exhausted and physically exhausted from the treatment of the pandemic. But I tell you, they've been resilient and they are continuing to press forward in spite of what's going on around us as a whole. So hats off to them as a staff. I'm proud of them, doing a great job. Let me hit on masking real quick. We're required as an institution, healthcare institution, to wear masks in the hospital, hands down. It's a federal regulation. And so community members have been a little hostile towards our staff about masking at the hospital. So I ask you to please respect and encourage others to respect our staff. And when we ask you to put on a mask, to please put that on or wear it when you come in. No one likes wearing a mask. We don't like wearing a mask, and I get it. But we also know that that's an effective way to mitigate the spread of COVID and even the flu, for that matter. In fact, we saw evidence of that just last flu season. If you go back and look at what the flu was like, it was almost non-existent. And so we believe that masks do make a difference. They are a end-all and preventative all, but they certainly make a difference. And if you can't social distance, we certainly encourage you to wear a mask. Visitation locally, I'm proud to tell you that we still allow visitors. There are other hospitals throughout the country and throughout even this region who don't allow visitors into the hospital to see patients. But we believe that's an important part of the healing process for our patients. And there's just a couple of caveats to visitation. One, we don't allow people who are 16 or under to come into hospital for visitation. And we don't allow visitors if a patient is COVIDed and we're treating them for COVID. We don't allow that, but we do work on getting that person to be able to communicate with their loved ones via Zoom or FaceTime or whatever mechanism we can get you to see the individual. So that's important. I want to talk about emergency care real quick. We are seeing record numbers of patients in the emergency room. In fact, oftentimes we're seeing over 100 a day. And that's a good thing. We want to see patients in the ED come see us. It's much better now than it was when COVID first started, when nobody was accessing healthcare. So we're proud of the community for accessing healthcare as a whole. But if people are coming to the emergency room to seek and they're asymptomatic and they just want to get tested for COVID, we don't do that here at Peterson. You need to go somewhere else to get tested if you're asymptomatic, and there's a variety of places you can go that Chief Maloney just discussed with you to go get tested. Even the home therapy or the home test kits can do that. Now, there's a therapy out there that some of you have heard about. It's the monoclonal antibody therapy. It's a great source and resource for those who have been exposed and or who have COVID, but there's some criteria that I want to educate you on. And we are strongly encouraging that because it is keeping people out of the hospital. So what is monoclonal antibody therapy, or how does it work? It's called that. It's also called infusion therapy, but it's certainly a way of treating COVID-19. The goal of the therapy is to prevent hospitalizations and reduce viral loads and lessen symptom severity. This type of therapy certainly relies on monoclonal antibodies, and these are antibodies that are very similar to the ones that our bodies produce naturally in response to an infection, but they're designed to recognize a specific component of the virus, like the spike protein that's in the outer shell. By targeting the spike protein, these antibodies interfere with the virus's ability to attach and gain entry into our human cells as a whole, and they certainly give our immune system a leg up in response to and mount up against the COVID-19. But this therapy, it's effective, but it's not the replacement to get the vaccine. We still strongly encourage people to get the vaccine, but it is a therapy that is very helpful. Who's eligible to get the vaccine? There is some criteria that your primary care doctor would know. You need a prescription to get the therapy, but certainly those people who are high risk are eligible, and those high risk things are people over 65, overweight, chronic kidney disease, diabetes, weakened immune system. There's a lot of risk factors. You can look up monoclonal antibody therapy and you can see those risk factors and see all the criteria that who would be eligible for that. But I want to promote that as an option, that we've been doing this therapy from the moment it was available to the public. We were one of few in the region doing it, and we continue to do that. It's important to understand that post-exposure, even with the monoclonal therapy, you can get it for even post-exposure. If you develop symptoms, it's recommended that even if you post-exposure, even if you have that, to quarantine and to get tested within about 24, 48 hours after symptoms. That will yield the most accurate result, just not 1 hour after you felt like you got exposed. It's not the right time to go get tested. But with the monoclonal therapy, you need to get it within 10 days. Don't wait longer than 6 days to get tested and see if you have it or not. If you're post-exposure, post the therapy, you might not be eligible. So make sure that you're getting tested and know whether you have that or not, or been exposed or not to a positive patient. To date, we've given over 600 doses or therapies for monoclonal, so it's very safe and it's effective, and we strongly encourage it. Let me give you some quick data real quick. Chief Maloney gave some of that, but I want to emphasize a few things. Today, we currently have 38 patients hospitalized, and that wavers up and down based on admissions and discharges, but this moment when I'm talking to you, there's 38. 95% of them are unvaccinated. There are days when 100% of the patients who are admitted have not been vaccinated. So it's really evident that those who've been vaccinated are least likely to be admitted and have the dire symptoms that COVID experiences. Back in July, when this thing started trending up, look back at the data, and Chief mentioned it, we had 4 patients in the hospital. We were hovering around 0 to 4 prior to July. And as of August 31st, we hit 40, which is a new record for us as an organization. And it's overwhelming. It's resource intensive here at the hospital for patients. And we hope that we start seeing the trend down as a whole, and we have hope that that's going to happen. The patients that we're seeing now that are admitted are younger than they were prior to our earlier waves of COVID-19. We're seeing patients now, our youngest that we had admitted now is 17, and that's going up. They range in about 50s. I guess our overall average is about 62 right now, compared to over 70 from the last wave. So we're seeing a younger population now being admitted. It makes sense because that's the group that's least likely to be vaccinated, and those are the ones most likely being admitted from the data that we're seeing. So we're encouraging you to go get educated on the vaccine. It is safe. We certainly are a proponent of it. The patients that we're testing for COVID, if they're positive or not, it's it's trickled up. Back mid-July to late July, we had a 10% positivity rate of those who we tested. 15 days later, August 1 through 15, it went up to 14%. 15 days later, it went up to 16%. And on September 1st, yesterday, it was up to 18%. So our positivity rate isn't going down. Our hospitalizations are going up. There's a trend there that we're concerned about as an organization, and we should be concerned about as a community. I think I'm starting to see more people wear masks. They're a little bit wide-eyed now and a little more, wow, this thing is real going on. It's really trending up. And so I'm seeing more masks, but we certainly encourage more masks to be worn. I'll conclude. That's a lot of information I've shared. I'll conclude with this. We asked an ICU nurse, what can the community do for you specifically? And she said, we really appreciate the food, and we appreciate all the things in the notes, encouraging notes, and all the accolades that people are giving us. But if the community really wants to know what they can do for us, the nurse said, go get vaccinated. As I said, Peterson strongly encourages it. It's a personal choice. And we recognize that. It's a personal choice, and we support that 100%. But make sure you're getting the true facts about the vaccine and not from the social media, some falsehoods and some drama that's out there, the statements. Make sure you're going to sources of truth about that. It's safe. We've had lots of people here vaccinated. There's been millions vaccinated at this given point in time, and it's a safe way. We continue to be positive here at Peterson as a whole through this entire pandemic. We haven't wavered a bit as an organization. We've run towards the pandemic. We haven't run away from it, and that's just who we are. We're here for you, whether you've been vaccinated or whether you haven't. We don't discriminate or treat you differently based on your vaccination status. We're healthcare professionals, and our goal is to get you well and discharged no matter what. We've celebrated with patients that have exited here, discharged here post COVID. It's been we've had some joy here from that perspective. We don't love having to treat patients with COVID as far as because it's devastating to the family and the patient and exhausting to the staff. But when we're successful in getting them discharged, we do celebrate that. I will tell you that we've gotten a lot of calls and information, been overloaded with calls in our ED and the urgent care center and even the hospital. And I encourage you that if you have those questions, that you seek our website to maybe go to our website first before inundating the hospital with calls. We're certainly really busy taking care of patients. We want to answer the questions, but you might be able to find those without calling and discharging us as an organization or the staff to answer those. We want to be available to answer it, but I will tell you it's been overwhelming to hundreds of calls a day with COVID questions. Visit our website. We have frequently asked questions there with answers. Also, we encourage you to visit other sources of truth for answers too. So thank you, Mayor, and thank you, community.
Right. Thank you, Cory. Thank you, Eric. Let me just say in conclusion, take care of yourself, take care of your family, take care of your coworkers. If you have not been vaccinated, get the vaccine. We will be a safer and healthier community if you do. Thank you very much.